Welcome back, everyone. It is time for the All-Star Political Panel. I'm your host, Lauren Hunter, and I have Dr. Whaley still here with us. He's going to be sticking around for a little bit. And then, of course, we have Bruce and Rick. So, Rick, go ahead and start us off. What have you been waiting all week to talk about?
We did a little audible at the line this morning, okay? We had a little juggle in the lineup, so...
Omaha.
Yeah, Omaha. So we've got a few minutes to tap into our resident brainiac over here, and
Dr. William Whaley.
Yeah, I didn't know this was going to happen, but as it happens,
send her back.
I pulled, yeah,
Oh my gosh,
exactly.
let's not.
Let's not go there. I pulled a few pieces off the internet that are relevant these days, and I thought. Doc's got 15 minutes, and he said he could stay with us till Richie joins us. Jane couldn't make it this morning. She's got to head to Atlanta, and she had some cooking to do, I guess.
She's picking up the grandkids.
Taking a break, yeah. Anyway.
She's bringing them home.
A statement was made by AOC. Nobody is heartbroken at the prospect of losing private health insurance.
Rubbish.
How in your years of practice would you evaluate that statement vis-a-vis where we are today with healthcare?
Who is that made that statement?
Alexandria Ocasio-Cortez.
And who is she?
She's a
I love it.
Well, that's
representative
I'm not an expert.
from a district in New York
I
City.
see. Okay,
One of
well,
the- one of the
all right. So
boroughs.
she's not a physician. She's not an insurance company executive.
Exactly.
All right. So
She's a politician.
yes, she is.
So she knows
politician.
everything, right?
It is my firm belief that the majority of American citizens believe that they are responsible for their own happiness and responsible for their own health care, and they're responsible for their own automobiles and their pickup trucks, and that they will choose the type of vehicle that they want based upon their expectations of what they want out of transportation, and choose a big car or a little car, and that most people will want to participate in their own health care maintenance in a preventative fashion by joining in a health club or eating that junk we were talking about
The
there.
hummus and the ground bison.
Or they will ignore it by drinking more than they should and by smoking, and that they want to have skin in the game. Then when it comes to choosing the degree of health care that they get, they would like to have some control over who they see, whether they see a man or a woman, or whether an old or a young, and what hospitals they go to, and so forth, and that the only mechanism by which that really works is you either write a check for it out of your pocket, like when you wreck your car, you go and you pay the guy to fix it, or you get State Farm or somebody to sell you some insurance so that if you bang up your car, they'll help you pay for it. And I think most of us in this culture expect that we will insure ourselves in some fashion against catastrophe at our house, catastrophe with our car, catastrophe with our health, and that we are married to the idea that we're responsible for it, and we would be very, very upset to lose the ability to have that choice and to have our own insurance.
Well, we've gone through one round already with the former administration saying if you like your doctor, you can keep your doctor. Now, Biden is back on the trail saying the same thing. Is this deja vu all over again? I mean, all the socialist candidates, and there are many, they're all pushing for Medicare for all, Medicaid for all. We're offering free health care to illegals, and some of the people...
And they're taking it.
And they're taking it
yeah,
in
right.
certain age groups. So is it about control? I don't see any...
I think it's totally unrealistic to believe that you can reach a funding mechanism that if there is any freedom of choice on the half of the provider, would say that provider will be available to every funding mechanism, because if you just look, the provider has to sign up for it and agree to take it. And we know that we've got sports medicine docs and plastic surgeons and everything else that don't take Medicare and they don't take insurance. You got to pay for it. And so it will not happen that under a plan of this sort that you will be able to keep your doctor. The other part is that you can't afford it. Now, if they had come down, and I don't believe I won't use the word socialism. As I began this whole thing, when you asked me, I believe everybody should have skin in the game. And if, as we today, there may be a percentage there, but I believe a percentage of our GNP, this health care, is above 10. It used to be in the 6s and 7s. It might even be 12. If you had a tax on everybody, including that 50% that don't pay income tax at all, for health care, that amounted to, say, 3% of what they made, that's not much. So if they're on the poverty line, take their 3%, which is next to nothing, and provide them the same degree of medical care you provide to me or the President of the United States, and tax me and tax the other folks up there at the same percent. You could eliminate the infrastructure. And then you could supply medical care to everybody. But if you don't have skin in the game, then you're not a good consumer of what you're trying to buy.
But you can almost bet your bottom dollar that politicians will not.
Oh no, of course not.
3% tax on people right around the poverty line.
No, they won't.
Right.
Of course not.
I mean, they just won't touch.
No, they
it.
can't. But here's what happened in Georgia years ago. Back when they made a feature of welfare, an obligation to work. Now you remember workfare, and that was in Georgia, and I was here at the time. Then if you were healthy, the blind, the lame, the old, I'd give them take care of them, yeah. But if you were 25 years old and in good health and you were on welfare, they put you to work, and they put you to work all over the state of Georgia. The number of people on the health care roll, on the welfare rolls went down like that. When they used to have a copay of 50 cents for a prescription under Medicaid and $2 for an office visit to see the doctor under Medicaid. The Medicaid consumption of health care in the emergency room and everywhere else fell by a huge number because the Medicaid people were using the emergency room as a doctor, and it was free, and usually when they went in there they'd get a Coke and a cookie while they waited. But once they started charging them $2 to go to the ER or 50 cents to go get a prescription, the demand fell down. A tiny amount of skin in the game will make the person a more educated consumer.
So then this begs the question that a lot of the politicians are saying, if you have skin in the game, then health care, unlike what Bernie is saying, is not a right, it's a privilege.
Yes, it's a privilege.
Would you agree with that?
I'm old, and I have read the Constitution of the United States. I've read the
present company excluded.
I read the Constitution of the United States, and nowhere do I find under
inalienable rights
that to health care. It's not in there.
Right.
No.
Can you, just switching gears a little bit, but I mean, the healthcare system now with private insurance and government and all this, how has it gotten so, kind of inflated that, someone comes and sees you and you send the insurance company a bill for $6,000. Then you get this statement back, insurance will pay $130 and Medicare will pay this, and there's this huge gap.
Yes.
How did it ever get like that?
It was.
Okay.
I used to be in the durable medical equipment business. In order for you to get this nickel, you had to submit that quarter, and hopefully they're going to pay 3 cents. They were allowable.
This all began with Medicare.
Exactly.
In the 1960s, where they set what was called the usual and customary charge for a geography. So the EKG in Macon, Georgia, would have been $15, and the EKG in Manhattan on Park Avenue would have been $35.
Okay.
So the usual and customary was a geographical number that had to do with what people charged in their office and were paid by cash. And then Medicare generally approved 80% of usual and customary.
Okay.
And you were expected to pay the other 20. Well, soon as that usual and customary became the benchmark upon which the 80% was set, then if they're getting $35 in Manhattan, they make an EKG went to $35 immediately, because what the guy in Manhattan was getting paid 80% of $35. The guy in Macon was getting paid 85% of $15. He had the same machine, the same paper, and everything else, and that wasn't fair, so to speak. So that the physician, hospital, drug company, DME company, and everybody else, when they began taking these geographic imbalances out of it, drove that number up. And the idea, I had a hip replacement here about 3 months ago. If you look at the bill, I mean, you'd think I'd bought a fighter plane to go to
you
stealth,
got the new F-35.
Yeah, and the poor guy gets paid $700 or something for the hip replacement. Back in the early days of Medicare, when most surgeons didn't take Medicare at all, I can remember Slocum Howland, that very famous guy's family's very famous. Slocum said, one of these days Medicare is going to be your best payer. Everybody laughed at him. And none of the orthopedists took Medicare or Medicaid. On a volume basis, they really didn't have to. They've been driven to it later on. But a hip replacement was $8,000. Cataract extraction was $1,400. Well, cataract extraction now, the guy gets $180. And a hip replacement's down below $600, $700. It used to be $6,000 or $7,000 back when a dollar was worth a lot more than it is today. And they by continually raising the price and lowering what they pay you, that's created that huge disparity.
But has that approach worked for Medicare? Have they really?
No, of course not. Oh, Medicare caps everything. Yeah, Medicare.
But they're still losing money.
Yeah, yes, but it costs. If you have a private physician that sees you in his office for a blood pressure check or something, he's getting paid about $28, in all sincerity. And the bill that he's sending is his standard bill. It's going to be for $90 or $100 for a brief office visit.
Yes.
The greatest neurologist that I know, I think I told you once before, walked out of his office and dropped his keys at noon one day and said, I quit. He was the neurologist that the National Football League used for 100% of their chronic brain injury patients, regardless of where they lived. And they sent those to this specific neurologist in Atlanta to be seen to say, yes, they've got it, no, they don't. So they had worldwide reputation. He would not see a new patient unless he could book 1 hour and 20 minutes to see them. His overhead was $450 an hour, and Medicare paid him $125 for a new patient visit. Well, when you have a gimmick like a gastroenterologist who can do a colonoscopy or a cardiologist who can cath you, he can afford to take $125 visit for $125 for the new patient visit when his overhead's $450 for that hour, because when you get finished, you're going to go over to the hospital and he's going to cardiac cath you or do a gastro and a colon. But a neurologist didn't have a gimmick. So if he did not have an EMG machine.
Gimmick.
What's a gimmick? It's exactly that. If he did not have an EMG machine. If he did not have an EMG machine. In fact, they did have EMG machines. When they had the EMG machines, they could afford to do this. Well, 2 years before this happened, Medicare took the EMG machine out of the neurology armamentarium and placed it in the hospital as a hospital
gimmick,
study,
huh?
as a hospital gimmick. So almost all big neurology practices have broken up. Nobody is being trained in neurology anymore. Neurology is an extremely complicated specialty, and without any gimmick, they can't make a living. And so all of them are going to be working for HMOs or going to be working for the VA or something like that. And there are none that are really of high quality going into private practice anymore. Now, some that are still there.
Doesn't Medicare and the AMA know this? I mean, don't they read the tea leaves? And
Now,
see
you
what's going on?
used AMA. AMA represents 21% of doctors. 79% of doctors are not in the AMA.
Yeah, they're almost irrelevant.
Yeah, they are
Is
irrelevant.
there any group that does represent a larger?
The specialty groups do. The American Society of Clinical Oncology, the American Society of Cardiology. So they are, and the American Academy of Family Practice, American Society of Internal Medicine. So physicians have unionized, so to speak, or joined their affinity groups, and those affinity groups have congressional power. But the AMA as a group as a whole has essentially no power today.
I'm going to jump in as your scheduler right now, okay?
Maybe we need to. Can you sell some ad time now for a minute? All right.
We appreciate you staying with
Yes,
us today.
thank you,
I think
Dr.
I mean, I think what we covered this morning is extremely
Good.
relevant to everybody watching.
Well, I hope so.
So, we'd love to do a full segment with you one day when next time BKP goes out of town and Bruce and I get charged to do the show, we'll do the 8 to 9 hour with you.
I'll tell you who is really good at this is Ray Tidman. Ray Tidman is a rocket scientist.
And he's got good
Literally?
jokes.
Yeah, he was an aeronautical engineer, rocket scientist before he became an MD, and he'll be here a couple of weeks while I'm on
Yeah, well, you're
vacation
going
the
to
next
Russia.
few weeks. Yeah,
Good.
Wow.
And I tell you, you get him in here, and you got a smart man.
Be easy on those Ruskies, okay?
That's crazy. All right, guys. Well, we will be right back. Dr. Whaley is going to step out. Thank you, Doctor, again for being here with us for your segment and then for sticking around for the All-Star Political Panel for a minute. And we'll be right back to continue the All-Star Political Panel right here.